Hi everybody. It's been a little while since I have posted a video. I took a much needed break to go hang out with a very dear friend at her lake house in Minnesota, and it was really rejuvenating. I am responding to a request by a subscriber who wanted to understand a bit more about how to recognize and then work with a pattern of compliance and defiance in patients. So, if you think about it, a character structure that is organized around an excessive focus on and reliance on confirmation and approval from others, right? These are patients who tend to sacrifice self, right, to be in relationship to others. So they are passive, compliant, and subservient. Very often, that is the initial presentation you are going to see. And then occasionally, you're going to see them flip to defiance, which is, again, just the flip side of compliance. So whether one goes along with and caves in to the demands and requests of others, or resists and defies them, again, the person is not coming from any kind of solid sense of self. They are just reacting to the other. So, again, this is really a personality configuration, a passive compliant personality. And it's a very common personality type that we will see in our practices. And it's much more common that you're going to see that initial presentation as opposed to someone who is overtly defiant and obstructionistic. We can certainly get that, and that's most often that they are being referred by somebody else, right? By, a spouse or their primary physician or a boss or something like that. But again, it's important to remember that these are just flip sides of the same coin, and that it kind of makes sense that someone who is always sucking it up, right, to appease the other, is going to eventually have a lot of resentment build up inside, and then they can just flip and become defiant. In any case, these kinds of defenses, right, against their own needs, feelings, and so on, must be prioritized. These patients often come in complaining of depression and symptoms that are actually the inevitable result of their personality configuration. And there's quite a bit of research to suggest if you only address depression and not the character organization that holds it in place, you're not going to get any lasting change. So we really have to target the characteristic habitual tendency to comply and be passive and subservient, which will very often come up with us. And patients will rarely present this as a problem, right? They don't come in saying, you know what, I have this tendency to be compliant and subservient. I prostitute myself for approval, right? They will come in with, I've got anxiety and depression and things like this. So they are going to actually show us rather than tell us about this underlying problem. So I'm thinking of a case that I was recently reviewing. This man came in with the presenting complaints of severe depression from childhood, accompanied by really significant suicidal wishes and ideation, migraine headaches, and impotence. So again, he didn't in any way report that he had a problem with passivity and compliance, but I could see it. And in his presentation, this was an immigrant. He had come to the US not because he wanted to, but because his father wanted him to. In fact, he was also had pursued a profession that was really of his father's making, and even had married a woman who his father had chosen for him. And this is where we could begin to see the flip side of this defiance. He was really resisting and playing out sort of a battle with this wife, not really because of her, but because she had been chosen by the father and because he had complied, but then was resenting it and playing that out. So as I was taking some history of his presenting complaint, and then as we began to identify some conflicts with others, he was talking about something that was happening with a supervisor, but he said, but you know what, he's just like my father, it's the same issue. And so I said, well, where should we start, with the advisor or with your father? And he said, well, what do you think? Now, how would you respond to that question? I think most dynamic therapists would tend to say, well, what do you think? Some therapists might even answer the question and get into the driver's seat and then reinforce or enact this dynamic in which they are taking over and the patient is complying. So this really underscores a really major pitfall with these folks, right? If you ever get into the position of assuming authority and telling them what to do, you are totally feeding into their only responses are compliance or defiance. So this is a really important case in which you always want to be asking them the questions and not getting into that position of you answering. So instead, I pointed out the process. I said, you're asking me? Isn't this the very pattern that we've just seen elucidated? You said you don't want to be in the United States, but I see that you're here and your father didn't have a gun to your head, right? So is this the same thing? You put your life, your therapy in my hands, right? So is that what you want to play out here? And he said, oh no, got it, right? So he was unconsciously enacting this. It was up to me to spot it in the here and now between the two of us, highlight it, and again, put the choice in his lap, not only about whether we were going to look at the father or the advisor, but whether he was going to take the lead and take an active role in his own treatment, or he was going to put himself in a one-down subservient position with me, right? So it is crucial that you catch this and that you refuse, in a sense, to play it out, that you highlight it, you bring it to consciousness, and you put the choice into the patient's lap. Now, again, sometimes they might just flip. So another case I had was with a much older woman who apparently had spent most of her life not just complying, I mean, she really had prostituted herself in all kinds of ways in order to, quote, get, love or approval from other people. And then she said, and at some point, like 3 years before, she had decided just to flip. And she said, the hell with that. I've done nothing but take care of other people and focus on them and their wishes. So I decided, as if this was the solution, I'm only going to care about me, she says. And I said, well, how's that going? How is it to live caring only about yourself? And that's when she said, well, it's dry and brittle and it's not a solution. Right, so this again gets back to that issue about the polarities between the need to be a distinct and separate self and the need to be connected. Ever sacrificing one for the other, it's Sophie's choice, it'll never work, and people will often flip from one to the other. But the issue is, and the goal is, to help the patient access and reveal their true self and to be an authentic presence in relation to others. That's not possible as long as someone's playing out this compliant defiant thing. And even if they start to feel a bit better and the depression lifts, they're not going to have any lasting benefit unless you address this relational pattern, which is really a manifestation of the patient's defenses, right, of passivity, compliance, and subservience. So I hope this helps and, elucidate this dynamic, which is so very common, as well as giving you some strategies for how to intervene effectively. So give me your feedback and questions, and we'll keep the conversation going. Bye-bye.